The purpose of this video is to provide the process for proper management and response to hazardous drug spills to prevent exposure to staff, patients, and visitors. Each spill kit contains 1 chemotherapy gown, 2 plastic chemo waste bags, an N95 respirator mask, goggles, 1 disposable scoop with detachable scraper, 3 spill towels, absorbent pads to soak up spill, a caution sign, 1 pair of shoe covers, 2 pair of gloves meeting ASTM standards as chemotherapy gloves, 1 inner, 1 outer, and a hazardous drug exposure report. Now let's get on to donning PPE. First, don your shoe covers. Next, your chemotherapy gown. Be sure to tie it at the back and at the base of the neck. Next, your N95 respirator mask. Next, your goggles. As you can see, a hair cover is not required, nor is it provided within the spill kit. However, you are encouraged to tie your hair back before proceeding with cleaning a spill. Now let's get on to donning our gloves. When donning your gloves, the first pair, which is the innermost pair, is tucked under the cuff of the gown. This is to prevent any form of hazardous drug material from seeping in between the glove and the gown and getting to your skin. The second pair is then pulled over the first pair and pulled entirely over the cuff of the arm of the gown. Now we're ready to clean up a spill. Let's start first with liquid. You first want to erect the caution sign to prevent and restrict people from accessing the area. Then, prior to tackling the spill, assemble your chemo waste bags so that they're ready to receive waste. You can then use the scooper to shift away any pieces of glass or broken vial. Place an absorbent pad over the hazardous liquid to soak up the spill. You can do this after removing the large vial pieces or beforehand in order to ensure that there is no transfer of hazardous liquid in the movement of the broken pieces. Following cleanup, we use Paradox to deactivate and decontaminate. Following the first application, we wait 3 minutes dwell time before the next application of Paradox. Thus totaling 2 applications. Let's move on to management of a hazardous powder spill. With powder, we don't brush or sweep it, as it can increase the spread of the hazardous material. We place water into one of the absorbent pads and place it over the powdered spill. This allows for ease of the powder uptake as well as minimal spread and exposure. As in the case of the liquid, we then deactivate and decontaminate with Paradox, allowing for a 3-minute dwell time before the second application. And then we're done. Now let's look at how we doff our PPE. Starting with the gloves, we remove the outermost gloves first. Whilst keeping the innermost gloves on, we remove our gown. The process of removing the gown involves rolling the outermost exposed surface of the gown in on itself, tucking it in such a fashion that it limits contact with the rest of your body. After discarding the caution sign and removing your shoe covers, you then want to proceed to remove the inner gloves. You start by first pinching and holding the outside of the glove near the wrist area and peeling downwards until the glove is completely removed, holding only the inside out part of the glove. Then remove your respirator mask and your goggles and discard in the chemo waste bag. You can then put on a fresh pair of gloves to tie the chemo waste bag closed using the provided tie wrap. The final part is, of course, proper hand hygiene. Be sure to wet, lather, and scrub your hands and your lower arm area for at least 20 seconds, then rinse and dry. Documentation and reporting of all spills using the Hazardous Drug Exposure Report form is a key component to hazardous drug spill management. This form should be filled out and returned to pharmacy.